Do you frequently feel like your heart pains sometimes? Or maybe you've had asthma for years and lately things just aren't getting better, even with inhalers. What if I told you that your body might be fighting itself without you realizing it? That's what happens in a rare disease called Eosinophilic Granulomatosis with Polyangiitis, once known as Churg-Strauss syndrome. It's like your immune system gets confused. Instead of fighting germs, it starts attacking your own blood vessels. This causes swelling, inflammation, and can harm important organs like lungs, skin, nerves, and even the heart. Imagine your immune system as a loyal guard dog that suddenly starts biting the family. That's EGPA in simple terms, a friendly protector gone rogue. So what causes this confusion in the immune system? Well, doctors don't know the exact reason, but they've found clues. Most people with EGPA have a history of asthma or allergies, maybe hay fever, sinus problems, or severe reactions to pollen or dust. Think of it like this: your body overreacts to harmless things like pollen, like setting off a fire alarm for toasting bread. Then, for some unknown reason, this overreaction spirals into sending too many eager helper white blood cells, called eosinophils. These cells are meant to fight parasites, but in EGPA, they build up in tissues and damage blood vessels. Some people also develop this after starting a certain asthma medication called leukotriene modifiers, though it's not that the medicine causes it directly, but it might reveal the hidden disease. It's like turning on a light in a messy room. The mess was there, you just didn't see it before. Let's say you had asthma for years, and now it's getting worse out of nowhere. You also feel super tired, lose weight without trying, and get fevers for no reason. Sounds like the flu, right? But wait, now your fingers or toes go numb or tingle, like they're asleep all the time. That could be nerve damage from inflamed blood vessels. Maybe you see red spots or bruises on your skin that don't go away. Or perhaps your stomach hurts badly after eating, like there's a storm inside. Some people even feel heart palpitations or chest pain, like your heart is skipping beats. One patient said, "I thought I was just stressed, but my feet kept going numb and I couldn't ignore it anymore." These are red flags. EGPA usually comes in 3 phases. First, allergic symptoms, asthma, sinusitis. Second, high levels of eosinophils causing tissue damage. Third, full-blown blood vessel inflammation affecting organs. Not everyone goes through all stages, but the warning signs are real. How do doctors find EGPA? It's tricky because it's rare and acts like other diseases. But here's how it works. They ask about your asthma history, test your blood, and check for high eosinophils. Think of it as counting how many overactive soldiers are in your bloodstream. They might do a biopsy, taking a tiny piece of skin, lung, or nerve to see if blood vessels are inflamed. Imaging like chest X-rays or MRIs can show damage. One patient said, "They found weird spots in my lungs, and my blood showed crazy high white cell counts." To confirm EGPA, doctors use a checklist: asthma, high eosinophils, nerve problems, sinus issues, and abnormal tissue findings. Treatment: the goal is to calm the immune system. Usually, they start with corticosteroids, like prednisone, strong anti-inflammatory medicine. If it's severe, they add immune-suppressing drugs like methotrexate or rituximab. Think of steroids as turning down the volume on a blaring alarm. Most people feel better quickly, but treatment can last months or years. The key is early action, like stopping a small fire before it burns the house. Can we prevent EGPA? Right now, there's no sure way to stop it before it starts, kind of like you can't stop lightning from striking. But you can stay alert. If you have long-term asthma or allergies, especially if they're hard to control, keep regular checkups. Watch for strange new symptoms: numbness, rashes, unexplained fevers. Don't ignore them. Think of your body as a car. If the check engine light comes on, you don't wait for it to break down. Also, talk to your doctor before stopping or changing asthma meds. Monitoring your blood work occasionally can help catch high eosinophils early. While you can't vaccinate against EGPA, staying informed and proactive is your best shield. One patient shared, "If I'd known tingling hands weren't just from typing, I'd have gone to the doctor sooner." Knowledge is prevention. The good news, science is moving fast. Recently, a drug called mepolizumab has changed the game. It targets a specific signal, IL-5, that tells the body to make too many eosinophils. Think of it like cutting off the supply line to the overactive cells. Patients on mepolizumab often need less steroid medicine, which means fewer side effects like weight gain or mood swings. Some even go into remission. Their symptoms vanish almost completely. Researchers are now studying other targeted therapies and trying to understand why EGPA starts in the first place. There's also work on better blood tests to track the disease without repeated biopsies. One trial showed wearable sensors could track inflammation signs at home, helping patients and doctors catch flares early. It's like having a smoke detector for your immune system. These advances are bringing real hope to people living with EGPA.